Tasmanian Premier has announced what he describes as the toughest border control measures in the country in a bid to restrict the spread of coronavirus.
Last month, Tasmania was ahead of the game.
We are at war against an insidious disease.
The island at the bottom of the world had acted quickly against the threat of coronavirus.
It's very encouraging that Tasmania moved swiftly to establish control over its borders and to cut down travel into the state.
One day, late in March, there were no new cases recorded. But the dream of an island cut off from the pandemic was soon shattered.
A Tasmanian hospital is now in the grips of a coronavirus outbreak.
Tasmania's first death was a Ruby Princess cruise ship passenger who died at the Northwest Regional Hospital. More cases soon emerged, including dozens of hospital workers and patients. As the rest of the country experienced a gradual flattening, Tasmania's cases kept growing, with the northwest of the state becoming a pandemic hotspot. Soon, Tasmania had the highest number of infections per 100,000 residents in the country. 2 hospitals were shut down and the Defence Force was called in. Locals couldn't believe how quickly the infection took hold.
I think Tasmanians would probably expect it to be one of the last places, to be honest. We're on an island state, it's small, we're separate from the rest of Australia.
Lyndon Hunter is among about 5,000 northwest Tasmanians forced into quarantine because his wife is a hospital worker. While he's enjoyed the time with the family, it's been challenging and he's lost his casual job as an electrician.
Knowing a couple of people that have had the virus as well, and obviously made them quite unwell, it's definitely something that's hit home to a lot of Tasmanian people.
The man in charge of Tasmania's response, Peter Gutwin, had only been in the job a few weeks when he was suddenly facing some of the state's most difficult decisions.
It is serious. Now, Tasmanians need to understand that this is not a game. This is life and death. It could be your mum and dad. It could be your pregnant sister. It could be the people that you work with. It could be your children. If you don't follow the rules, you run the risk of killing them.
Brad Stansfield was the Chief of Staff to former Premier Will Hodgman and now a partner in a PR firm working on government communications during the pandemic.
Now, the number one rule of a crisis is when you're a leader is that you need to, or you're better, to overreact than to underreact. So if you overreact, maybe there's a bit of egg on your face afterwards. If you underreact, well, the consequences are going to be a lot worse.
Tasmania has had one of the lowest testing rates in the country, and the northwest's older population made it a high-risk area. But experts see the cluster as an example of just how quickly an outbreak could happen anywhere in the country. Bill Botel was a senior advisor to the Federal Health Minister in the 80s, and he was an architect of Australia's response to the HIV/AIDS epidemic. He grew up in Tasmania.
We can see how very quickly, despite all the precautions and the best efforts of healthcare workers and the Tasmanian government, that things can change very quickly.
He says states and territories contemplating a rollback of restrictions or testing should look closely at northwest Tasmania.
For the foreseeable future, as long as the virus remains in Australia, we will be susceptible to these outbreaks and clusters.
Professor of Epidemiology, Mary-Louise McLaws, agrees the region was unlucky.
I think it reminds us that this period where it looks as if we've got very, very few cases is probably the most dangerous period of all.
She warns only widespread testing will show if Australia is getting on top of the virus and whether it's safe to relax restrictions.
It needs to be very careful and very slow, but it really shouldn't be done until there's proactive testing in the community.
Leaving a long road ahead. Ellen Coulter, ABC News.